Hello, we are Indacaterol. We are a drug that affects the respiratory system.
In this video, you will get to know more about us.
Have fun!
Hello, my generic name is Indacaterol. I have brand names of Arcapta Neohaler and Breezehaler. My chemical name is this. Partner, what is my drug classification, pregnancy category, and my mechanism of action?
Yes, I'm going to talk about that right now, starting with our drug classification. Our therapeutic drug classification is bronchodilator. We make breathing easier by relaxing the muscles of the lungs and widening the airways. Our pharmacologic drug classifications are LABA, or long-acting beta agonists. We are inhaled medications that are used in the treatment of asthma, and chronic obstructive pulmonary disease, or COPD. Our second pharmacologic drug classification is adrenergic. We stimulate adrenergic beta 2 receptor, which results to smooth muscle relaxation. Some pregnant women may ask themselves, are the medicines that I'm taking safe for my baby? Well, for Indacaterol, the answer is no. Indacaterol belongs to pregnancy category C, which means that there are no adequate and well-controlled studies with Arcapta Neohaler in pregnant women. Arcapta Neohaler should be used during pregnancy only if the potential benefit justifies the potential risk to the fetus. You may wonder, how does Indacaterol help me breathe during asthma attack or with COPD? Well, here is our mechanism of action. Indacaterol works by stimulating the adrenergic beta 2 receptor in the smooth muscle of the airways. This causes muscle relaxation, increasing the diameter of airways that are constricted by asthma, relieves bronchospasm, reduces airway resistance, and improves bronchodilation. Now that you understand how Indacaterol helps you breathe during asthma and with COPD, my partner will now discuss to you how Indacaterol is absorbed, distributed, metabolized, and excreted by the body.
Now, let's explore our pharmacokinetics. We are absorbed in the body through single or repeated inhalation, with a median time to peak of approximately 15 minutes. For our distribution, we have 94 to 95% protein binding. We are metabolized in the liver with a steady state level of 12 to 15 days. As for excretion, we are excreted in the feces. Partner, to what we are being indicated?
As what Red Alert always reminds us, ligtas ang may alam. It is important for us to be knowledgeable about Indacaterol's indications and its contraindications for us to be safe. With that, let's first talk about its indications. Indacaterol is indicated to be used for the long-term maintenance treatment of airflow blockage in patients with chronic obstructive pulmonary disease, or COPD, including chronic bronchitis and emphysema. Now let's proceed to the contraindications. Indacaterol is contraindicated for those with beta-adrenergic agents allergy and those with conditions such as thyrotoxicosis, diabetes, low amount of potassium in the blood, high blood pressure, diminished blood flow through arteries of the heart, prolonged cardiac output interval on electrocardiogram, abnormal heart rhythm, abnormal electrocardiogram with cardiac output changes from birth, seizures, and acutely deteriorating asthma. Can you enumerate those contraindications now? Not yet? That's okay, but brace yourself because we are now going to tackle the side and adverse effects of Indacaterol. Let's start first with the side and adverse effects of Indacaterol in the cardiovascular system. We have the angina pectoris, atrial fibrillation, paradoxical bronchospasm. Rarely, Indacaterol can cause a worsening of breathing problems that may be life-threatening. If this occurs, get medical help right away. For the digestive system, we have nausea. For the lymphatic system, we have peripheral edema. Let's hear about the other side and adverse effects from my partner.
The Indacaterol side effects to the muscular system is muscle spasm or muscle pain. To the nervous system, it causes headache. In the respiratory system, its effects are pneumonia, cough, and pharyngitis. The most frequent adverse event was nasopharyngitis, and 15% with Indacaterol 200 micrograms. Now, let's talk about nursing responsibilities.
I'm sure that all of you have already heard the phrase, nurses are one of our modern heroes. And I think we all agree to that, because nurses will always be there to assist you in any way they can, including the administration of Indacaterol. In this part of the video, let us talk about the nursing responsibilities. Before administering the Indacaterol to the patient, the nurse must assess respiratory status such as the rate, breath sounds, degree of dyspnea and pulse before administration and at peak of medication. If severe bronchospasm is present, consult healthcare professional about alternative medications. Onset of action is too slow for patients in acute distress. If paradoxical bronchospasm or wheezing occurs, withhold medication and notify a healthcare professional immediately. Assess for signs and symptoms of allergic reactions such as difficulties in breathing or swallowing, swelling of tongue, lips and face, urticaria, and skin rash. Discontinue therapy if symptoms occur. Consider lab tests for Indacaterol may cause transient hypokalemia and hyperglycemia.
During administration of Indacaterol, the nurse should monitor patient response to the drug. If they experience improved airflow and relief of respiratory difficulty, to determine the effectiveness of the drug dose and to adjust dose as needed. Next is proper administration and dosage. The nurse should advise the patient to use the minimal amount needed for the shortest period necessary to prevent adverse effects and accumulation of drug levels. The nurse should ensure adequate hydration and provide environmental controls such as the use of a humidifier to make the patient more comfortable. Encouraging the patient to void before each dose of medication avoids urinary retention related to drug effects. The nurse should provide comfort measures including rest periods, quiet environment, dietary control of caffeine, and headache therapy as needed to help the patient cope with the effects of drug therapy. If the patient experiences GI upset, the nurse should administer oral drug with food or milk to relieve GI irritation. Necessary of the nurse to arrange for medical follow-up if symptoms are not resolved after 48 weeks of therapy, because serious underlying conditions could be causing the symptoms. It also important for the nurse to provide periodic follow-up, including blood tests, in order to monitor drug levels. And support and encouragement of the nurse helps the patient cope with the disease and the drug regimen. The nursing responsibilities after the drug administration will be discussed by my partner.
After the administration of Indacaterol, the nurse must advise female patient to notify healthcare professional if pregnancy is planned or suspected, or if breastfeeding. Monitor patient response to the drug such as improved airflow, ease of respirations, and improved breathing. Monitor for adverse effects. Evaluate the effectiveness of the teaching plan and monitor the effectiveness of other measures to ease breathing. Did you have fun learning with us today? Yes? Then that's great! Until next time, bye-bye!